I am from Lady Harding Medical College. So nurses and me, we were from Kalavati Children's Hospital and Lady Harding Medical College. I am married. I have 2 children, 1 5 and 2. My husband is from AIMS. He's a retina specialist. So this is my short summary before anybody makes any comments. Okay, now we are talking about neonatal skin care, which as a nurse is very important because you are the first person, especially the pediatric nurses, when they come in contact with the baby. Why is it important to have a neonatal skin care? It is because neonatal skin is different from adult skin. It has a higher skin surface area to weight ratio. In neonates, it is around 700 square centimeter per kg, whereas in adults is 250 milligram per square centimeter per kg. The pH of the skin is higher. The stratum corneum or the skin, the epidermis is very thin in neonates. It's around 30% less, it's thinner than the adults. It is less hairy and they have weak intracellular attachments. So these things make the skin more susceptible to infections. There are more chances of bacteria, viruses to enter the skin. So it's very important to know all these things. They have very less sebaceous glands. They have very less sweat glands. So the the neonates cannot secrete sweat as efficiently as we can do. So they are rashes which can be associated with these problems. Then there is less of melanin production, so that makes them more susceptible to sun. So bright light and sun is another problem. Then there is increased susceptibility to external irritants, again because of these factors, and there is increased chances of micrococcal infection. Now, what are the principles of skin care of newborn? We should be very gentle with the newborn. There should be adequate hydration and moisturization of skin. They should prevent friction and macerations in the body fold, protection from irritants and protection from bright sunlight. Next slide. Now it's why vernix, as we all know, is the white coating when the baby is born. In the latest guidelines, it has been said that we should not remove the vernix because it's a natural barrier. It prevents heat loss. It prevents transepidermal water loss. It's a natural moisturizer and it does not infect. Only in case if there is HIV positive mother, then it is important to remove the vernix. Otherwise, the guideline says that do not remove vernix at the time of birth. Eventually, once the child starts taking bath, it will go. But you can just gently towel the baby and that's it. So you don't have to vigorously remove the vernix as it was done earlier. Earlier practices was that we remove the vernix, but nowadays the IMA also, the pediatric guidelines also says that do not remove the vernix. Next slide. So skincare starts, so the most current protocol suggests gentle toweling of the infant, leaving any vernix that is present. Like I said, that only in case if there is any HIV positive or AIDS patient, then only vernix has to be removed. Otherwise, there is no need to remove the vernix. So this you should know because you will be taking the baby in hand. And if somebody says, no, remove this, then you have to tell the doctor or the parents that this is not to be done. Next slide. So this is what we are talking about. So just gently wrap the baby and show the baby to the mother and then take it to the nursery. Yes, sir. So that's what I'm saying. So it basically prevents, if you remove the vernix, there is loss of water, transepidermal water loss is there, natural barrier is there. So it will make, and it will kind of, and baby, see, it's 9 months the baby is in the womb. So it's in a protective environment. Once he or she is out and suddenly there is so much of external thing for the baby. So one protection layer has to be there with the baby and gently we can remove it once the baby starts taking a bath and all. Next. Now, according to the latest guidelines, it has been said that baby should be only sponged till the cord falls. So there should not be any bathing of the baby. There should not be immersion bathing. Like you don't have to put the baby in the bathtub or give. So only till the cord falls, and cord falls normally in 5 to 10 days. So till then, only gently sponge the baby with water. The National Resuscitation Program says that in summers, neonates who are more than equal to 2 kgs are advised bathing. That is again sponging. But in winters, only neonates who are more than 2.5 kgs should be advised bathing. So if a winter baby is there, if the birth weight is more than 2.5, then tell the parents to go in for giving them a bath. Whereas in summers, if the baby weight is more than 2 kgs, then so you should, because then that's the reason birth weight is also important. We have to tell the parents that this is the guideline and you should not. Why this is important? Because smaller the baby, more the surface area, more the heat loss. So in winters, that's the reason 2.5 kg, slightly little to the term baby. So that's the reason they say, so that will reduce the heat loss from the baby. So 36.5 degrees Celsius is the temperature we have to maintain in the neonates all the time. So in winters, because the external temperature is low, so it kind of goes down. So that's the reason. And normally they ask to start with twice a week bathing. So it's not necessary to bathe the child every day, because they are anyways in a cot, in a clean environment, so they're not getting dirty. So you can just do it 2 days a week to start with. So the recommended practices, so once you start giving sponging also, so in the nursery, you have to wear gloves, implement universal precautions before and during the first bath. Removing all vernix is not necessary for hygienic purposes. Do not use antiseptic soaps or cleansers. If required, use little warm water. Use cotton balls or soft cloth, and avoid rubbing skin surfaces to prevent any chafing or irritation. So this has to be done. In the routine bathing, like when the child goes back, is discharged and goes back to home, then the main purpose is to remove the debris. So in this, a cleanser with a neutral pH. We don't want, see the child's pH is anyways around 5.5 to 5.6. So we need a neutral pH with minimal dyes and perfumes. Fragrances, perfumes or dyes tend to irritate the skin of a newborn because they have a very gentle skin. So we need to use a cleanser which has a neutral pH with minimal dyes and perfume, minimal coloring, and again avoid rubbing the skin surface and gently rinse it with little warm water. Now comes when the cord falls, then how should we go about? We should use water of temperature around 36 degree to ensure an even temperature, decrease the evaporated heat loss. After bath, dry, diaper and double wrap. We have to put a cap in all the babies because as we all know that head and the extremities are the main sources from where the heat loss is there. So double wrap, diaper and dry the baby, and after 10 minutes, because once the wrap will soak the water, then change the cap and then wrap it in a warm blanket. So this is how we do. So these are nowadays, I don't know about the nurseries, but they have these bathtubs which have a elevated thing so that the head doesn't go down. So they kind of elevate the baby and just give from neck to below. So head, and they just clean the head with just soft cotton balls or wraps. Now next thing is the scalp. The care of the scalp. Shampoos are soaps or synthetic detergents which specially formulate to clean the hair. They are mainly medium to long chain fatty acids such as laureth sulfates, which are best cleanser. Minimal time of contact to avoid irritant dermatitis. The pH of the shampoo should be close to tears. Why? Because if it kind of goes into the eyes, then the child should not have any irritation. So it should be around pH 5.5. Now a common thing which we see especially in neonates is the cradle cap, or what we call the dandruff on the scalp. So which is actually because of when the child is inside the womb of the mother. So because of mother's hormones, some children tend to develop that kind of dandruff. So it is similar to the dandruff what we have. So the best treatment protocol is first ask the parents to avoid oiling. It is a very big myth that parents say dandruff is there, we have to oil the child. Oiling only tends to make it invisible. It is there, it is just that little bit of moisture is there so that dry scalp doesn't show. But oil definitely increases the dandruff, the cradle cap. So what you have to tell the parents is stop oiling the child, especially the scalp is not to be required. And especially in a case of cradle cap, oiling is totally avoided. Use shampoos containing cetrimide. company, there are Johnson & Johnson shampoos available, there are Cetrilac shampoos available. So use a very, you can dilute the shampoo, gently rub the scalp, try to remove those scaly part while you're shampooing and just wash it off. Sometimes if it's a severe case, we have to give low potency steroids because there is irritation, the child is cranky because of that. So we give mild steroids to take care of that inflammation. But it normally settles down within a month, 2 months, so nothing to worry. Sometimes cradle cap can lead to seborrheic dermatitis. They have in the neck folds, in the groin folds, they can have mild irritation, which also gets better by maximum by 3 to 6 months of age. Now the next important thing is the umbilical cord. Recently in my hospital, in BL Kapoor Hospital also, what they do is they have stopped cleaning the cord, because that's the only raw area which is present in the neonate, which is the source of infection. So there are a lot of people, they say we want to put oil, we want to put lal tel, there is like a lot of things. So we have strictly told the parents not to use anything till the child is in the hospital. Once they go back home, once they discharge, they can only clean it with spirit. So spirit basically evaporates, so they just clean it and the area is dry. So keep the cord as dry as possible. Because so spirit swabs are there. नहीं, spirit swabs से मिल जाते हैं. Just normal swab है, उसको बस clean करना है. In case if there is any discharge, then a little bit of antibiotic creams like mupirocin or fusidin can be applied in case if there is any infection. Otherwise, just clean it. We have to avoid the water. Water, if only thing is if it is soiled with urine or stools, then also clean it, like dip the cotton ball in the water, squeeze it, clean the area and then put the spirit so that it dries. So it should not be wet. Then because sepsis, we have seen cases of sepsis because of cord cleaning, excessive cord cleaning. So you have to be very careful. And only tub bath is only once the cord falls, which is 5 to 10 days, after 5 to 10 days. I would like to tell you another thing is that when a female child is born, there is this breast nodules sometimes which are present. And there is these massage dyes and massage people. So we have to tell the parents, we have to tell everybody that do not massage those areas. There is nothing. They say there is witch milk and there is a lot of myths around. So we have to tell them because we have seen cases of abscesses forming there. So that has to be avoided. And one thing I was about to say, I'll just, it comes. Okay, now coming to the cleansers. Cleansers can be broadly categorized into 3 categories. True soaps, which has a pH of 9.9 to 10, which is lauryl sulfate. Syndex are the acidic or the neutral synthetic detergents. These are the soaps which a newborn or a children of pediatric age group should use because they have a pH which is closer to the newborn skin. So in the recent guidelines, they have been saying that Syndex to be used in neonates till first month of age, till at least first month of age. After that they can use anything, but if they continue to do it, that's also good because that will reduce dryness of skin and also reduce irritation capacity. And there are other bars which are like Combars, which are alkaline based. So what I'm trying to tell you is Syndex are the one which are most important. So cleanser is basically has a surfactant because we have to take away the debris which are slightly fatty. So composed of surfactant or detergent. A skin conditioner like glycerine, fragrance, color and should be avoided. Ideally a baby soap or a cleanser should be devoid of fragrance and colors to avoid irritation. And advantage of Syndex is that do not alter the pH of the skin and skin flora remains unaltered. So they are preferred till first 28 days of life. Now a controversial question. I'm sure Johnson & Johnson will not be very happy with me. They have to be avoided in newborns. I had a long discussion with the pediatricians. So they say that excessive use of powders, they basically are mica, so they can inhale. The child can inhale the thing and they can lead to accidental granulomas in the lungs. Other is excessive use can lead to blockade of duct spores. I normally, there is this myth, parents say that the child doesn't smell good, we need to use a powder. So what I tell the parents is that maximum you can use in the diaper area, because nowadays we all make them wear diapers. So there is that, it's a very moist environment in the diaper area. So there they can use a powder so that to make that skin little dry. Otherwise in the necks and all, it's not required. So it should be avoided. So as nurses, because you are the second, after the doctors, you are the next level to the parents. So please try to tell them that this is not a good thing to do. Because there are so many things in the market, they say that we want to use a powder because they smell good and all that thing. But at least till first month, they should be avoided. Next. Now coming to the diaper area. So diaper area represents a large, moist and humid, occluded environment which is more prone to maceration and attack by organisms. So the skin is also in contact with strong alkalizing agents like urine and feces, and the high pH damages the skin integrity. So what should be done? Next slide. So the mother should be advised to frequently change napkins, whether they are home laundered or super absorbent variety. At least every 3 to 4 hours they should be changed, and there should be areas of no diaper time, 6 to 8 hours, so that the skin is dried and aired between napkin changes. And it should be, if it is not possible to change the diaper very frequently, then mineral oil can be used on the buttocks to form a physiological barrier. Nowadays there are a lot of diaper rashes cream. So the basic component what we have to see is the zinc oxide. So zinc oxide is it's like a contact barrier, so it has to be used. So Johnson & Johnson has they have recently launched which is a good zinc oxide barrier cream. So you can tell your patients that they can use every diaper change, but possibility, see, diaper rash came only because we are using diapers. Before that nobody used to get, until unless a child has a history of diarrhea because of some other reasons, then only diaper rashes used to come. But it's our only make, because we use diaper, then the diaper rashes started coming. So no diaper, there will be no diaper rash. So if possible, don't use diaper, which is not possible. I have 2 children, and it's a working mother's boon to use diapers. It's not possible, but then use a diaper rash cream. So it's important. It is important that bottom should be white from front to back. If the feces that sticks an emulsion like baby lotion can reduce the surface tension and clean the debris. So you should not very vigorously remove the feces from there. And if a napkin rash occurs, petroleum jelly or zinc oxide containing creams can be used. And for home laundered diapers, usually washing in lukewarm water followed by rinsing and drying is sufficient. Now coming to the emollients for baby. So what is an emollient? It's an agent that softens and smoothens the skin. So there are various type of emollients like hydrocarbons, which like Vaseline and paraffin, fatty substances like cetyl or sterile alcohol, waxes like beeswax, lanolin, oils like mineral oil, vegetable oil, and coconut oil is the most important among them, olive oil. Next. So emollient is a safe and effective way to decrease neonatal peeling. It maintains the barrier function, reduces irritation all over the body, also the napkin area, and there is a little bit role in massage. Now coming to oiling of baby. We have seen that especially if we vigorously massage the baby, especially in first month of life, it normally causes lot of folliculitis because of vigorous massage. There can be chances of malaria formation. There is this sweat gland blockage because of oil. So what I tell my patients and parents is that if you can avoid oiling, then it's better, especially in summer months. So there is this myth that with oil there will be strong muscles, strong bones and all, but it basically is like a moisturizer, nothing else. It doesn't. There was one study which said that till oil, especially in preterm babies, led to a little bit of increase in birth weight. Otherwise, no other oil has seen any systemic absorption of the oil that leads to better weight gain or anything. So only in preterm babies, that was also in till oil, they have seen a little bit of birth weight, increase of birth weight, the normal weight, but otherwise no oil causes. So it's just basically a moisturizing thing. And it should not be also done very frequently. So it should be like twice or thrice a week you can massage the baby. And coconut oil is preferable because it's time tested, small molecular size and easy to use. Olive oil is preferred but slightly expensive. Sesame oil or the til oil is more so in South India it's used. As a dermatologist, we normally advise the patient to avoid mustard oil. Mustard oil has an antigen called allyl isothiocyanate, which can lead to contact dermatitis, which can lead to rashes in the baby. So mustard oil should be avoided. Rest can be done, but with caution, no vigorous massaging, gentle massage, and then give bath to the baby so that oil doesn't stay on the body. So that's all I would like to. There is any question, anything, any doubt? Yes, ma'am.
Regarding application of oil on babies, generally we need that oil after, like by practice, actually, not as an as. Like do oil massage before the bath, you can use coconut oil or sesame oil. And even many of the research studies have proven that it decreases the body weight of the newborn. Probably especially for the premature babies. And in medically pediatric genetics use, they nurses have the routine of applying oil massage in the morning and in the evening also. At least once in a day, where they do massage with the oil. And studies have proven it as even a double-sided study.
So that's what I'm saying. So only in preterm children. So normal children no, but preterm children til oil. So there was a South Indian study only. So where they said that it has led to a little bit of increase, but we don't know whether it was just taking care of the baby which was increasing the thing, because there was no test to check that whether the oil was actually getting absorbed in the body and leading to. See, that's what I'm saying. So vigorous massage is to be avoided. Gentle massage is fine, but in summer especially, because it stays on the body, it can lead to blockage of pores. So it could be done like 2 days a week or 3 days a week, followed by bathing. And in winters you can probably do it more often, but again in winters we are not doing bath every day. So again it becomes twice a week. So what I would say, see, there was this, that's the issue, there is a lot of controversy around this. Because as a mother also, I had my mother-in-law who said, oh, you are supposed to oil the baby, that's good for the bones and everything. But as a pediatric dermatologist, I said, no, don't do it. So there was this always a contention. So in between, I would say, maybe do it like 2 days a week, gentle massage, don't allow the dai or that massage lady to come, because they do it pretty vigorously. And then it's fine.
Orally also for weight gain.
Orally is fine. Orally you are from South India. Thank you, ma'am.
Thank you so much for all this information. I just want to clarify first thing that there are many ladies who come with a lot of kajal and all. This is also one of the factors which is there prominent among the Indian scenario. So I just want to advise that the ladies should be told about
yes, it should not be done. My husband is a ophthalmologist, so again this was this controversy that kajal, because they make the eyes big and all. But we have seen cases that the kajal blocks the eyelid pores and leading to boils, which we call chalazion and everything. So it should be avoided. Kala tika वगैरह लगा लें, मतलब जो normal होता है, but not the kajal.
And secondly, I just wanted to know what is your take about using those bikes which we are using, and it is so much into fashion nowadays, and almost whether you see it to be a working baby or a non-working baby, but it is mandatory as a part of a baby care, which is coming up along with the diapers. Every diaper, the sleeves of the diaper, they will apply those bikes and then they will put little knots.
So that's what I was saying. So it's like it's a working. See again, how will you clean? They are good in a sense that especially when you are going out, the baby is with you, they do the potty and susu and whatever. See, but there are wipes which are available. Again, the pH of the wipe should be around, according to the baby's pH, which is around 5.5. They should be free of fragrance. They should be free of any perfumes. They should be free of any of these. They have these cleansing lotions. There are a lot of things. But the market is flooded. So it's very difficult for us to do a research on which wipe is better than the, same as which diaper is better than the other diaper. But after a certain age, once the baby is handleable, like around 6 months or 7 months of age, then you should start wiping baby with normal water. Then wipes should be avoided. I have seen wipe allergies. I had a patient who was getting frequent diaper rashes. We were not able to pinpoint that why is the patient having it. Then we came to the conclusion that the wipes are causing the problem.
Actually, it's starting the microflora of the baby.
But if you say if you're traveling to Jaipur as somebody was traveling, and if you have a baby, you cannot go to the loo, you cannot clean the baby, you have to use wipes.
But I would say that when we are cleaning a diaper, had it been a normal diaper that is washable every time, at that moment of time also we are just removing the diaper and we are not cleaning the area, we are applying a fresh one. So it should
No, but we have to wipe the area also, no?
unless it is a stool.
Unless it's a stool. Not with the urine, it's not required, but yeah, with stool, you definitely have to remove. So if you are using water, which is actually a better thing than doing wipes. Wipes is again, see, it's a costly thing. It's like approximately 1 rupee per wipe, if you see accordingly. So it's around that, maybe I think more than that, 2 rupees a wipe. So affordability is one thing. Then how much? It's actually a convenience. That's what people. I am not in favor of wipes, but at times we have to. So I was joking the other day that who discovered the diapers should be given a Nobel Prize, especially by all the working mothers. Anything else? Thank you.